because it's always that magic question. Can you see my screen?
Yes, I can see your screen.
Thank you. All right. Okay, so today what we're going to be talking about is we're going to go over radiology. And I know you're thinking, I'm a medical assistant. What do I need to know radiology for? Actually, it's really pertinent to what you're doing. And I've had a lot of students who have gone on to and worked for a doctor. One particular is one of my students. Her name was Gabrielle, and she ended up getting a job with a podiatrist. And come to find out, who knew? Every single patient that came in, he was taking x-rays of their feet. And she's like, I don't know how to do this. And he's like, it's okay, I'm going to train you. And a lot of my students end up getting a little one-on-one crash course and end up doing x-rays. And apparently, it's something that's not uncommon. So you understanding about it, understanding the procedures is important as well. Now, you may not ever do that, but you need to understand the process, because here's why. When you are doing a pre-authorization, or you are giving a patient their pre-op or pre-procedure information, you need to be able to explain to them, okay, Mrs. Jones, here's what we're doing today. I'm scheduling, I'm going to get with your insurance and get approval, and the doctor wants you to have an angiogram. And this is what it is. This is how this is what you'll need to do to prepare for it. And this is what you'll need to do the morning of, the night before, and afterwards. All of that information is vital. And that's our job as an MA, to give them and prepare them so that they're not left in the dark and they're not wondering, what was I supposed to do? And it's always really important with some of these that they're fasting, and that they don't take their 6-carat diamond ring to the MRI place with them, because we don't want them to, have a chance of losing valuables. It's important that they know, okay, I'm supposed to drink this, the night before to clear my bowels. Why? So we're going to go over that. We're going to talk about all these things. All right. In radiology itself, this you might want to jot down, take a note, is a branch of medicine. So, and it uses a radioactive substance. It does give off radiation. So anytime we are thinking about being around this, or we are going to be exposed to this, there are lots of precautions that have to be taken. And when I say lots, I mean quite a bit. If you've ever gone in for an x-ray, you've seen they not only a lot of times will put you in a leaded apron, they'll put themselves, they have one on and they wear little tags. I'll explain about those. And they go and stand in another room. And that's because there is radioactive material that's being, emitted from doing this x-ray. Now, radiology is not just x-rays, okay? There's a various bunch of techniques, okay? What they want is to be able to visualize internally. Now, sometimes if it's just, say, a bone, an x-ray will do. But other times we need to see more in depth. We need to see deeper. And there are specialized tests for these things. We're going to go over that. We're going to talk about these tests, one by one. And I never can say this man's name right, but his name was Wilhelm, and I think it's see, because it's the TGN, Rogen? I'm not sure. But he was the man who invented, he had a great beard too, working with the old mustache. He invented x-rays, and it was kind of like by an accident. And I posted that video in Teams that I wanted y'all to watch, and it explained, I thought it was an excellent video. And I thought, explained how he found it and how he used his wife as the guinea pig. It's like, here, stick your hand under here. But basically, he found out by using the different tubes and stuff where he was working with and experimenting that he could get imaging this way. So it was really amazing. And it's, you think about it, 1895, that was right at the beginning, right when, we started seeing a lot of new medical inventions that just took the world and changed it for the better. As a medical assistant, okay, so this is you. It's your job to assist the patient at all times. And that's what I'm always talking about, fluid, 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 fluid. If I train you and I say this is how we're going to do it, and you go to a doctor's office and the doctor says, this is how I do it, what are you going to do? You're going to say, okay, and you're going to do it exactly the way that they tell you, because this is what we do as MAs. We're fluid, we're positive, and we're there for support of the doctor, our other staff, and our patients, right? And of course, we'd never do anything to put our patient or ourselves at harm, but most doctors aren't going to put you in that predicament. We provide, as far as imaging, we provide post-procedural instructions. That means we want them to know what they're going to need to do afterwards, and we also provide them all of the instructions, like I was talking about prior to. And we can sometimes be the person who will call and give the patient the results. Like, say Dr. Miller says, hey, April, you've got Mrs. Jones' file there. Go ahead and tell her that that big toe of hers wasn't broken. So you can give her a call up and let her know, hey, Miss Jones, Dr. Miller wanted me to relay to you that toe's not broken. He thinks it's just a bad sprain, and whatever the instructions were. And like I said, provide that support to have them prepared for the procedure. And a big portion of it is that pre-authorization and scheduling. So as a medical assistant, you might be required to contact their insurance, which you will be. You will be on the phone and, talking back and forth, and one department to the next, right? You are the liaison. You are the person that works with the insurance company, gets everything approved, and then contacts the patient, right? And says, okay, this is what I got so far. And then you get a hold of the place where the procedure is going to happen. And then with, say it's Clearwater Imaging, and you contact them and say, hey, I have a patient. She needs to have an angiogram. And what days do you have available? Then you'll call back Mrs. Jones. Well, Mrs. Jones, they have this day and this day. What would work best for you? Lots of phone work. That's why we're talking about, when we talked about communication, how imperative it was to be able to communicate. Communicating and being able to make sure your patient understands the procedures before, during, and after. Okay? Does anybody have any questions so far? Nope. Silence? Crickets? Okay. I'm going to take that as a good thing. All right, so what are the principles of X-ray? Okay, so we know that there's a tube, and then it has a beam. It shoots the X-ray down, and whatever we place in between that and the plate will project an image once it's developed or processed. I explained that not so good. That's why I posted the video in Teams, and it talks about how, it gives that the one video gave you a really in-depth, like probably more than you ever wanted to know about how X-rays function. But it was also really cool because it probably told you things you never knew. I know it did for me when I was watching it. I was just like, I didn't know that. So, and if you haven't watched those X-ray videos, The radiology ones that I've posted in Teams, please make sure you do so. If you are a virtual online student, it is imperative, if you want a lab grade, that whenever I post anything, I always put, make it important. I place online lab, and then it is your job to respond back to anything that I put on there. And you can respond either with a question, and we can talk about it, or you can respond with something you learned about it, but a response is required, okay? Principles for X-ray or radiographs is by projecting. And like we were saying, this is the same thing over. It's just projecting the X-ray through the organ or structure, and then it places it on a photographic film. And this is how, you know, a typical X-ray machine. So we're looking and we see that the beam usually comes from here. And then if you notice, there's a plate, and you'll see they're like thick, about 2 inches thick. Some of them are small, some of them are big. And the X-ray technicians will go in there and place them and slide them in place. And this is the film. This is what, when they process it, gives us the image. Oh, take a look. That's a nice patella she's got there, right? So when a patient has a procedure that's done for, say, like a knee or this, you notice how they have her garbed up with a lead apron. This would be something to protect. And the reason they do that is why? This requires somebody to answer. Why do you think we put lead aprons on our patients who are having X-rays? Don't make me, I'll randomly call somebody. What was it? I heard somebody.
Like radiation?
Yeah, because of the radiation, and we don't want to damage their bits and pieces. If it's a lady, we want her to be able to not damage her female organs. If it's a man, the male reproductive, we worry about their a lot of times the reproductive organs and the heart, the chest, the thyroid, those kind of things. So a lot of times you'll see those are. Go ahead and whoever's got their mic open, go ahead and you can turn your mic. But that's the main reason we do it, is we do it to protect the patients because of the harm the radiation can occur. Even though it's a quick burst of radiation, it's not something that we would still take chances of. That's why if you're a female, how many times when you go in, did they ask, are you pregnant? Is there any chance of you being pregnant? When was your last menstrual? Sign this waiver. Are you sure you're not pregnant? Because it can damage. So that's why they take precautions. So let's go on. Let's talk about an overview of the different types of diagnostic imaging. So X-rays, ultrasounds, radiopharmaceuticals, which that just sounds cool to begin with, radiopaque media, computers, and basically any type of processing of internal structures. And this includes like CAT scans, MRIs, and angiograms. We'll get all into this. This, as I thought, was pretty amazing. And I read the story behind it, and apparently the person survived. It was left in place, which with any type of impaled object should be. And they were able to get to the person to the emergency room. They were able to do surgery, extract it, and correct any bleeding, but it didn't hit anything major, which to me was just like, wow. As you can see, it's past Hilton deep. All right. The next thing, you want to write this down. This is something you want to know for your notes. What is contrast medium? Contrast medium is the substance that a lot of radiographic testing requires to enhance the visibility of the tissue. So this picture here I found is really a good example of what we're talking about. So here is figure 1. Now, yes, we can still see kidney. You can even see the renal pelvis here. And you can see the ureter to the bladder. But once we add a contrast, you can see so much more. We can see why on this side we're not having the flow. We're not seeing the ureter like we should, and that's because here's healthy, here's somebody with a stone. This stone has occluded. Where's the ureter? Because there's an occlusion from that stone. And you can see it looks like they've got a few more in there as well. So contrast, this one is the IVP. We'll talk about that. Contrast gives them that ability to see more in depth, to make things stand out. Okay? So that's, like I said, that is a note. You'll come back. I'll post this like I do all the PowerPoints through YouTube. You can go back and watch it and take notes at your leisure. Now there's different forms of contrast. First one we'll talk about is a negative contrast. So a negative contrast means the density of a hollow organ can be reduced. Basically what they want is they want to fill it with air or gas. And what this does, it provides a contrast. You see how the large intestines here is, and this, not most of the time when they do in the lower GI, they use gas or air, and they want to blow it up so that they can see details and be able to have a more a vivid image of what they're looking for, especially if the patient's been having, complications like pain or issues with their bowels, stuff like that, rectal bleeding. And one of the things that you'll want to remind your patient about when it comes to these procedures is in a discreet way, is that Ms. Jones, they're going to be doing a lower GI study, and that involves air. So just between me and you might be passing a lot of gas after the procedure. So, because you do, and it's not fun. And it's like the old, what was his name? The comedian, he said the walking farts. And that's what it is for about 30 minutes to 2 hours after this procedure. Because you do have that. It's walk. So a contrast medium can also not just be gas and air. It can be liquids and powders as well, and they use that a lot by either injecting it or an enema, or giving it orally for the patient to drink. And a lot of times, write this down: barium sulfate and iodine are the two most common. These two, both of these are separate types of contrast, but they both work well as far as, like you can see in the picture, allowing the image to be shown and stand out compared to the area around it. And that's one of the main purposes of contrast. And this looks like something vascular that we're seeing here, and they're probably looking either for some kind of blockage, occlusion, or they're checking to make sure. I know that people they believe that had strokes, or after certain procedures, they'll do exams like this where they go in and they look in detail to make sure that everything's healing correctly and the procedure worked and so forth. Remember, if you have questions, feel free to ask. And if you've got to unmute yourself, if I see a couple of y'all have, I don't see the hand thing when I have this full screen, okay? The history, some guy named Walter Bradford, he discovered it, contrast medium, and he he first started using it with something called bismuth, which is actually really toxic, but he didn't know that. And then eventually it was replaced with barium sulfate, which is a lot more safer. But he used a sodium iodine treatment actually for syphilis and for his patients who would come in. These are all kind of the, you know, the forefounders of, you know, the medicine that we take now and that we have done on a, you know, some daily basis. People are having, you know, radiographic examinations with contrast and stuff like that. And if old Walter hadn't have decided to play around and figure out how to ways to improve and figure out how to make an X-ray, as far as Wilhelm and then Walter here with his contrast, we wouldn't have the capabilities that, you know, we have now to be able to see inside somebody's brain without dissecting and cutting and opening it. All right, and that's a big thing. That's, I mean, because you'd have to agree with me that I'd rather have an MRI of my brain than somebody going in there cutting it open and taking a look, right? All right, so the use of the contrast, and like I was saying, it provides the image to be able to stand out. So there's different contrasts give us different results. A positive contrast, like a barium sulfate and iodine, like I said, those are two you need to know. So you'd want to write that down. They're really good because they work well with the radiographic test. Barium sulfate, for example, it's chalky, it's white, and usually patients have to drink it. And they'll do that when they're trying to study a patient who might be having trouble with swallowing, or a patient who has a possible goiter, thyroid issues, different things like that, or for upper GI issues. You, as the MA, you need to make sure that if there's a pre step that the doctor has, that the patient is informed you're not supposed to eat after midnight. This is very, very important, because if you do so, it may affect your test and you'll have to come back and redo the procedure. This is why getting that information to our patients is so vital. All right. And like I said, these are commonly used for GI, our gastrointestinal tract exams. Okay. And you can see here, it's in a little bottle and it doesn't taste really good. Then this is the side effects. I like the metallic-y taste. And then I've had a lot of these tests. And then one of them, when they do my MRI of my brain with contrast, when they inject it, everything, you get this hot feeling and everything flushes over, and it's really kind of creepy. And it's the dye. It's the iodine dye. You can feel it going through your body. And they always warn you and tell you, but I was like, I know, but even though I know, it's still always weird every time I have to go in. And I go in for brain imaging because of my MS, yearly, and they have to do that. And each time they do it, I'm always still like, whoa, that's crazy. So you'll want to let your patients know if that's something that they're going to have done, that they might feel like a warmth, or they might have like a strange metallic taste in their mouth. Now this number, it says 5 there because I stole this from something, but it said products like air and tap water and stuff. These also can be used as contrast. And sometimes they'll mix fruit juices and different things like that for the patient, especially with oral exams, okay? And let's see our time. We're at 28 minutes, and I think we're doing good. I want to cover iodine. So, and I got our little shrimpy here. I personally don't like shrimp. I know I'm the weird person. I chicken and turkey. That's it. But a lot of times we use iodine because of its radioactive properties. And it's excellent for thyroid, it's excellent for small vascular, like in the brain and so forth, angiograms. And then I'm going to put somebody on the spot here, cholecystograms. Tell me what that is. Make my day now. I'm even going to look to see so you can type it out. I'm looking. Nobody? 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 No.
I think I got it.
What is it? I didn't hear you. Y'all still see my screen? Did I lose y'all?
I still see it.
Oh, okay, thank you.
Iodine compound.
Polio is what?
It's an X-ray procedure.
What is this fruit? I'm bringing you back to first class. This is gallbladder, guys. Come on, y'all. Don't make me start quizzing y'all again on medical terminology.
Oh yeah, I just now see it's a gallbladder on X-ray.
Yes, it's a gallbladder study, right? So Graham to record. Okay, I can definitely tell we're gonna be going back and doing some medical terminology review. Remember the little cards we smacked up all over the room? Y'all still have that. We got to make sure we keep up on this. Those words ain't going anywhere. I told you when we started, they will be with you forever. So why might somebody need a cholecystogram? Well, perfect example. You start having pain in the mid-epigastric area and you're like, oh, there's a little discomfort. And you go and it keeps going on, keeps going on. You go to the doc and the doc says, well, let's take a look, make sure that ain't your gallbladder. And then sure enough, bam, it's the gallbladder. So then they were able to take care of that. That's what happened to me. But I didn't have a cholecystogram. I actually had an ultrasound, and my stones they were able to see just with an ultrasound. But so this is iodine. Now here's why and you ask, well, why in the heck does she got a picture of shrimp? Because if you didn't know, shrimp contains iodine. Seafood has iodine. So if your patient is allergic to seafood and you see that on their chart, that should be highlighted and made sure that that's reported to the place where they're going for their imaging or their procedure. Because we don't want them to be given something with iodine and cause some type of anaphylactic reaction, right? That would be very, very bad. All right, I'm going to stop here because I am at that 32-minute mark and I know attention spans. Okay, so do we have any questions or anything? You do. You're going to have to come closer to the mic.
Okay, hold on.
Because you sound far, far, far away.
Me now?
I can hear you better. Yes, sir.
Okay. So for people that cannot do things with the iodine compounds, what is the substitute? Like if they're allergic to iodine, is there a substitute?
Yes. Yes, there is. But my mother was allergic to iodine, and so she couldn't have any type of iodine type of products. And off the top of my head, I'm gonna be straight up honest with you, I cannot think of the name of what they use instead. But what I'll do is I'll find that out and I'll post it to y'all in Teams. But there are alternatives. So
Okay.
yeah, they do, and I know that for sure because there are, believe it or not, quite a lot of people who are allergic to iodine. So that's why they have them options. But the most common one that they're just going to go to is the iodine compound or the barium sulfate type of compound because they work so well. You know what I'm saying?
Yeah.
And they're also very cheap, very inexpensive. But I'll let y'all know what the other types are.
I got one question.
Uh-huh.
It's still with the iodine. So what if someone doesn't know that they are allergic to iodine?
That's
Like,
a wonderful, wonderful question. Now, here's how things are set up. When you go in for one of these procedures, you're going to have, there's always a doctor on hand. You may not see that doctor, like when you go into imaging centers and stuff like that, there's always a doctor. And they have crash carts, code carts, stuff like that. So say if our patient was given an eye, if we've never had it, we don't know if we're allergic to it, and they started exhibiting signs of anaphylaxis, the itching, the swelling, and this and that, immediately the procedure would be stopped, and then they would probably do something like get the doctor in, and and a lot of times us as paramedic, when I was a paramedic, we were called to places, even we were called to doctor's offices and imaging clinics a lot because 911 is the go-to. And so we would get there, and sometimes they'd already been administered epinephrine to reverse the anaphylaxis and the respiratory issues. Then sometimes the doctor, they had even started IVs, and we're giving them steroids and had given them Benadryl. But then other times we'd get there and they'd just be like, whoa, we don't know what we're doing. So, but that's what they would do. And it's, and then like most anaphylactic things, this is no different. If especially you have a very big advantage because you're right there at a medical facility and they're going to be able to see, okay, something's not right. So it's not usually a really big ordeal, except for the fact that now oh, hey, no more iodine testing for me, but we normally find this out because most people like shrimp. I'm the weirdo that doesn't, but most people do enjoy seafood, and they figure it out. Now, sometimes people can eat seafood and not really have a reaction, but still have, because it's small, tiny quantities. So, but still have a really large reaction to when it's administered intravenously. Make sense?
yes. The reason why I asked,
Uh-huh.
I think you already answered it. Sometimes people aren't allergic to shellfish or stuff like that, but when they go into like having stuff like that, they are allergic to
Yes.
iodine. So
Correct. And that's because when we eat that bit with the shrimp and stuff, we're just getting small amounts of it, right? But when they do an intravenous iodine or IVP, that's straight into the vascular system. So if we are if it's sensitive, it's going to be more extreme, right? And this is the weird thing about allergies, and allergies can develop anytime. You may not be allergic to iodine your entire life. You might be a shrimp eating fool, and at 70 years old you got to go have an angiogram and they give you IVP and you have an anaphylactic reaction because they can develop at any time, even if you've never previously been. I know a lot of people who take medications, certain, like antibiotics. So I've taken this my whole life and I've never had an issue. And then bam, it just happens. So there's still a lot unknown about why sometimes those antibodies stop. Any other questions? No? Okay. Well, I've got a couple of videos, a lab type videos I'm going to place into Teams, and I will find the name of that other compound that they use, or contrast. And actually, why don't we do that right now? Because it's going to drive me nuts. What do they use if someone is aha. Somebody else had looked. Aha. There we go. It can carbon dioxide. That one I've never heard. I think this is the one that they used with my mom. This sounds familiar. Now let's look it up. Gladium. Oh, so yeah, that's really interesting. It says it's a chemical element and it symbols GD. Well, that's yeah, and take a look here. So I guess it would be like the alternative to iodine for people who are, and I'm almost certain this is what they were using. And yeah, you see, it still produces beautiful imaging. So I'm glad you asked that question, because now I learned something too, or remembered something I didn't remember.
Yeah.
All right, guys. Well, y'all have a wonderful day. I know that all of you, because y'all are my superstar students, have already done your SurveyMonkey, but if for some reason you haven't, get it in.
And one more thing, Miss Scaffold.
Yes,
what was
ma'am.
the two main things that we needed to know again? Because I didn't have my pen in front of me at the time.
That's all right. So there's a couple of things. You can always go back. I want you to know.
No, I'm talking about the two main medicines. I think it was
iodine and barium sulfate. Those
yeah, that
one. Those are the two most common contrast medias, or you can just call them contrast.
Okay.
Thank you. Iodine and yeah, barium sulfate. Anybody else? No? Okay, guys. Well, I have got a new start tomorrow. So what that means is I am going to be assigning things for y'all on Teams, and we will pick back up with this lecture late tomorrow afternoon. Sound good?
Okay.
All right. Yeah. Thank you, guys. Have a wonderful day.
You too.
Bye.
Okay, you too. Bye-bye.
Hi, everyone. Thank you.